Hello and welcome to this short webinar on Florida Medicaid coverage of speech therapy. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the Florida Medicaid fee-for-service coverage of speech therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check with payer policy. On the website, our Florida Medicaid section contains more detailed information on outpatient therapy services, fee schedules and code lists, information on billing for non-covered services, information on qualified Medicare beneficiaries, MCO plans, and members can always request information or ask questions about Medicaid coverage and compliance. Speech-language pathology services provide for the evaluation and treatment of speech-language disorders to remediate and maintain communication functioning, acquire a skill set, restore a skill set, and enhance communication. Services must be rendered by a licensed SLP, an SLP provisionally licensed, and an SLPA certified and working under the supervision of an SLP. SLPs may supervise speech-language pathology students while providing services to a recipient. The speech-language pathologist must direct the care, make all clinical decisions, and be responsible for the recipient's assessment and treatment. The licensed SLP must be present for the entire treatment time and may not treat another patient or engage other tasks while supervising a student. Covered services: one initial AAC evaluation every 5 years per recipient. For recipients under the age of 21, one initial speech-language pathology evaluation per year, one SLP reevaluation every 5 months per recipient, up to 14 therapy treatment units per week per recipient, maximum of 4 units per day. Group therapy must be at least 30 minutes in duration and may include no more than 6 participants, and the group may include non-Medicaid recipients. One follow-up AAC evaluation upon delivery of the device, and up to 8 30-minute AAC fitting, adjustment, and training sessions per year, and up to 2 AAC reevaluations per year per recipient with a device. Early and periodic screening, diagnosis, and treatment. As required by federal law, Florida Medicaid provides services to eligible recipients under the age of 21 years if such services are medically necessary to correct, ameliorate a defect, a condition, or a physical or mental illness. As such services for recipients under the age of 21 years exceeding the coverage described within the policy or the associated fee schedule may be approved if medically necessary. Florida Medicaid does not cover the following: developing and updating the plan of care, mileage and travel expenses, multiple AAC fitting, adjustment, and training visits on the same day, securing, installing, or maintaining therapy equipment, services not listed on the fee schedule, telephone communications with recipients or their family members, except for services rendered in accordance with the Florida Medicaid telemedicine policy, time spent supervising assistants and students, and treatment visits provided on the same day as an evaluation. SLPs must develop and update a recipient's plan of care based on the results of a speech-language evaluation, and it must contain the following: a medical condition including diagnostic codes, functional limitations, specific therapy to be provided, short and long-term therapeutic goals and objectives, medications, treatments, and equipment, treatment frequency, length, and duration, therapeutic methods and monitoring criteria, diet as indicated, if applicable, means of demonstrating and teaching the recipient, family, and other relevant caregivers, and coordination with other prescribed services. Providers must obtain authorization from the Quality Improvement Organization at least every 180 days or upon a change in the recipient's condition requiring an alteration in services. Thank you for watching, and please visit the website at therapycomply.com for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe, and we'll be adding many more videos soon.